Hello, welcome to my YouTube channel, Medics in Minutes. Today we will look into the history of subarachnoid neural block, or simply spinal anesthesia. Let's travel back to 1885, New York City, where neurologist James Leonard Corning made medical history. He was the first to describe using cocaine for spinal anesthesia, planting the seed for what we now know as the subarachnoid block. Corning's curiosity didn't stop at theory. He injected cocaine intrathecally into a dog, and within minutes, the animal showed marked weakness in its hindquarters, the first real evidence that blocking spinal nerves could produce anesthesia. Back in AD 200, when Galen first noted the presence of a fluid around the spinal cord. Centuries later, in the 1500s, Antonio Valsalva studied this fluid in detail, what we now call cerebrospinal fluid, or CSF. In 1891, Essex Winter and Heinrich Quincke described the dural puncture, opening the gateway to spinal anesthesia. Then in 1898, German surgeon Augustus Karl Gustav Beer made history, using intrathecal cocaine for lower limb surgery, marking the true dawn of modern spinal anesthesia. In a bold move, Dr. Beer and his assistant Otto Hildebrandt decided to test spinal anesthesia on themselves. Beer described procedures like needle pricks, burns, and even hammer blows, with Hildebrandt feeling little to no pain. But Beer wasn't spared. He developed a severe post-dural puncture headache, later linking it to CSF loss, and suggesting fine needles could help prevent it. In 1899, Dudley Tate and Guido Cagliari performed the first spinal anesthetic in the United States, in San Francisco. Soon after, Rudolf Marters in New Orleans pioneered the use of morphine in the subarachnoid space. And in 1900, Theodore Tuffier of Paris insisted that cocaine should be given only after CSF was clearly seen, a principle that improved both safety and precision. By the early 1900s, spinal anesthesia was evolving fast. In 1907, Arthur Barker of London introduced hyperbaric local anesthetic solutions, stressed strict sterility, and found the midline approach safer and simpler. In the US, Gaston Labat studied how the Trendelenburg position affected blood pressure, while George Pitkin used hypobaric procaine mixed with alcohol to control the height of the spinal block. In 1946, Adriani and Roman Vega introduced the saddle nerve block technique. But just a year later, the tragic Woolley and Rowe case in the UK left 2 patients paraplegic, causing anesthesiologists to abandon spinal anesthesia. With new IV agents and muscle relaxants emerging, its use declined, until 1954, when Drips and Vandam proved its safety in over 10,000 patients, leading to its remarkable revival. As spinal anesthesia evolved, innovation made it safer and more reliable. Herbert Green recognized that CSF loss was a key problem and introduced a smooth tip, smaller gauge needle, reducing post-dural puncture headaches. His son, Barnett Green, later refined it with a 26-gauge needle for obstetrics. The famous Green needle reigned until the Whittaker and Sprott pencil point needles of the 1990s, shaping the instruments we still use today. Thank you for watching this journey through the history of spinal anesthesia. Don't forget to like, share, and subscribe to Medics in Minutes for more fascinating medical stories explained in minutes. See you in the next one.